Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Johns Hopkins epidemiologists Amber D'Souza and David Dowdy about the concept of herd immunity from COVID-19 and why reaching it won't be as simple as we hoped for when the pandemic began 18 months ago. Let's listen.
Amber D'Souza and David Dowdy, thanks so much for joining me.
Thank you.
Thanks for having us.
Let me start with you, David. We're going to talk today about herd immunity and how to maybe look at it a little bit differently. So when epidemiologists talk about herd immunity, what do they typically mean?
Thanks, Stephanie. So herd immunity is a concept from infectious disease epidemiology where we think about the amount of immunity that exists in a population. And once that level of immunity gets above a certain level, a certain threshold, if you will, it makes it hard for viruses or other bugs to spread in the population. And so the idea is that if enough people are immune, they can provide protection to people who may not be immune just by reducing the amount of spread in the population from the disease.
And we talk about that often with things like measles, correct?
Yes, measles, most vaccine-preventable diseases, and it has been something that people have applied to COVID-19 as well.
Mm-hmm. But Amber, that's not kind of where things are going with COVID-19, is that right? I mean, we thought we talked a lot last year about hitting herd immunity for COVID, and then it would be gone, but that's not what really happened here.
Yeah, it's a little more nuanced than what we thought last year. So the coronavirus is like other infectious diseases. And once we get enough people who are immune, we will eventually get to a place where we don't have so many people dying from this disease. But because people who have immunity can still become infected and still spread the infection to others, it becomes a little more complicated than what we think about for some other infectious diseases.
And why is that relevant?
Well, because we still have so far to go to get to a place where we have enough immunity to slow the spread of this infection. We were really hoping that this winter would be much milder with a low rate of deaths, but we're not seeing that. We have 2,000 people a day dying currently in the U.S., and what we're going to need to get out of this is to develop a very high level of immunity, much higher than we currently have.
Is vaccine the way to go, David?
So, yes, I think that vaccination is an important component of this. So certainly the more people who get vaccinated, the more immunity we will have built up in the population. It's also important to recognize that the vaccine is particularly helpful against people getting seriously ill, having to go in the hospital, et cetera. And so even if we're not able to, with vaccination, get to a level where we're going to say this pandemic is over, we've eliminated this virus, it can still provide a substantial amount of protection against people getting really sick, which I think is really where we're trying to go at the end of the day.
Mm-hmm. So does the fact that, Amber, this disease can spread even through vaccinated people, does that change the calculus? Is that why the calculus has changed?
Yeah, I think that's really the key point now, that we have this vaccine, and thank goodness it is so effective at preventing death and hospitalization. But it does seem that people who are vaccinated, we know they can still become infected and spread and be ill. So it's not back to life as normal with no precautions, even once you have the vaccine. And it is important to understand you can still get infected as a vaccinated person, but you're going to be protected from severe illness and hospitalization.
And David, we're not at herd immunity also because so many people have chosen not to be vaccinated. Is that correct?
Well, so yes, I think that the lack of vaccination is one reason that we're not at a level where we would call it we're at herd immunity. I think that as Amber's already discussed, we also have a virus that is getting more and more transmissible over time, especially with new variants. And we as a society have also, I think, relaxed our behavior a bit. We're interacting with each other quite a bit more closely now than we were at the peak of the pandemic back in last winter. So there are lots of things that are contributing to the transmission of the virus. And I don't want to pin it only on lack of vaccination, but certainly that is an important contributor.
And it doesn't help that children cannot be vaccinated, correct?
Yeah, that is part of it. I mean, we also have the Delta variant, which is more transmissible. So there's multiple things going on that are making this year a little bit harder than we had hoped in our best case scenarios. But the fact that vaccinated people can still become infected affects how long it will take us to get this under control. But vaccinated people, there's still multiple benefits. It looks like when they get infected, they're infected for a shorter amount of time. So they're less likely to transmit it to other people than someone who's not vaccinated. But it's not zero risk. They can still transmit the infection sometimes.
That's right. And I think this is something that's important for people to recognize, that until we have a vaccine that is approved for very young children, we're always going to have a group of people in our population, those young kids, who are susceptible to this disease and who are able to continue transmission. We've seen in many other infectious diseases, you mentioned measles in the past, that these diseases often become childhood diseases. So diseases of kids primarily, with then some outbreaks in groups of people who are less vaccinated, which may be where we're headed with this pandemic as well.
Infectious diseases are really good at finding whatever the groups are that aren't protected and aren't vaccinated. So sometimes that's certain cities where vaccination rates get low. Sometimes it's certain ages that haven't had uptake. They'll spread wherever they find groups of susceptible people. But we have had some good news. The Pfizer just released some initial data suggesting that their trial data in children ages 6 to 11 looks very good, with side effects that are similar to what they saw in young adults. So very low side effects, very positive efficacy, and that's going to be reviewed. So it is possible that we will have emergency use authorization for younger children to get COVID vaccination, hopefully in the late fall or winter, which would really help.
So, Amber, you guys argue that we need to change our thinking about herd immunity. Can you explain that?
Yeah, I think earlier in the pandemic, the messaging, was let's get people vaccinated and it will be over. And that is the goal, that you get a high level of immunity and then spread will decrease. And while that's true, it's just a bit more nuanced because of these factors that been discussing. So what the change in our thinking really needs to be, and how we think about what's coming and what's next, is that what we can achieve is we can get to a place where we lower the rates of serious illness and hospitalization. So it may be that coronavirus is here to stay, it's going to continue circulating, but because the vast majority of the population will have immunity from vaccination or having gotten COVID and developed immunity that way, eventually enough people will have that immunity that when they get exposed, they will not get severely ill. And so that's the scenario that we are looking towards, trying to get to, and decreasing the number of deaths and hospitalizations.
David, do we know what the role of natural immunity is here?
Well, certainly natural immunity plays a role here as well. As people are getting sick from COVID, they are developing some level of immunity themselves. We know that if you've gotten sick and you get vaccinated on top of that, that boosts your immunity even further. But there is an important role for natural immunity to play as well. I think that what we're hoping is that over time, through both vaccination and through unfortunately people getting sick, there's going to be enough immunity in the population, as Amber has suggested, to not necessarily eradicate this disease, right? But to get it to a level that is tolerable, and that the amount of serious disease that we're experiencing is much lower than what it is today.
Amber, did we ever sort of think that we were going to eliminate this, or did we think we were just going to get to this sort of level where, for example, the flu kills, was it 40,000 people a year?
Well, early on, we didn't know enough to make a guess, right? When this was brand new, I think it's, we've come so far having a vaccine that works in this short time period. And although we haven't gotten enough people vaccinated yet, we have accomplished a tremendous amount in a short time. So we think we knew several months in that it did not look likely that we would be able to eradicate this disease based on the fact that it spreads quite quickly and that some people are asymptomatic. Whenever you have spread in asymptomatic individuals, it makes it harder to catch every case. So it's okay that we can't eradicate it. We're not able to eradicate most infectious diseases. But if we can get it down to a level where we are minimizing severe illness, people still get sick and have a fever and have to stay home a few days, but then go on with life, well, that would be a lot better than what we've been dealing with in the pandemic so far. It's not great. It's not what we'd love, but it's survivable, and it would be a big improvement.
Mm-hmm. I know that I always get my flu vaccine every year. And actually in January 2020, I got a terrible case of the flu. And I wonder, sometimes I think about that and I think, is that kind of possibly our future, that this could happen?
Well, I think that hopefully it won't be like a terrible case of the flu. Hopefully, as people get vaccinated, and again, unfortunately, as some people get sick, our level of immunity will not only prevent transmission in the community, but also reduce the severity of illness. And again, this is something we've seen very strongly with the vaccine, that if you do get sick, you don't get as sick. And so it's, I think, the hope that over time, that's where we'll get, that this is not something that is gone from our society forever, but that it is something that we can manage and we can live with without having to completely change everything that we do for this virus.
Yeah, that's right. But the analogy does apply in several ways, that even if we're all vaccinated and we get disease better managed than it is now, the virus is going to continue to mutate here and in other countries where it's spreading. And so it's possible that there'll be future variants. And so it may be that some variant emerges that our vaccine doesn't work as well against in the future. And we might have to tweak and develop a different update of the COVID vaccine, similar to the way that the flu vaccines are updated. And so that is possible if we think about the longer term future of living with this, that as it mutates, we may have to adapt and get some updates.
And I guess the one thing it has me thinking about, Amber, is you said that it would peter out, but it would still be a significant number of cases each year, similar to the flu. When will this pandemic, when will that part end? Can you look in your crystal ball?
Yeah, exactly. I'm looking. We're in between our best and worst case scenarios, I think, in terms of what's likely. Worst case scenario, we never get this under control, right? This is a global pandemic. There are a lot of countries where we need to manage this as the variants emerge. We've done a tremendous amount in the US, but not enough to control spread yet. Now, I believe that we are on track, hopefully, in this next year to increase our vaccination rates as we're able to roll that out to children, and as some people who didn't choose the vaccine before do decide to get vaccinated through mandate or through additional information. I think that combined with some common sense preventions in large gatherings and other social measures that we can take, are going to get us to a place where we can bring spread down. But I don't know that that's likely in the next few months. I think we're going into 2022 with this really being a very significant health problem. And I'm hoping that next year is the year we can get this under control.
Well, David Dowdy and Amber D'Souza, thank you both so much for joining me.
Thank you.
Thanks for having us.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggeter, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.